Hello everyone, thank you for listening to my presentation. I am Yin Xue. I'm from Department of Biomedical Engineering, Zhejiang University, and my advisor is Professor Ping Wang. The topic I present is a spiky neural network-based olfactory bionic model for periodontal diseases screening by exhaled breath with electronic nose. Periodontal diseases are mainly the result of infections and inflammation of gums and bone that surround and support the teeth. In its early stage, called gingivitis, the gums can become swollen and red. In its more serious form, called periodontitis, the gums can pull away from the tooth, bone can be lost, and the teeth may loosen or even fall out. Periodontal diseases are associated with several chronic disorders, as shown in the figure, according to data that collected in 2019. Periodontal diseases have become the seventh fatal disease in the world, as they have a serious negative impact on people's health and daily life. The timely diagnosis and prevention of periodontal diseases have important practical significance. To determine whether people have periodontal diseases, dentists may examine mouths to look for plaque and tartar buildup. Besides, they may measure the pocket depth of the groove between gums and teeth by placing a dental probe beside the tooth beneath the gum line. Radiographic assessments such as X-ray or CT can be taken to check for bone loss. Culture method and real-time PCR are used for detection of bacteria. However, these types of measuring approaches are very expensive, complex, time-consuming, and require well-trained staff. They are considered unsuitable for daily use. Studies have found that volatile sulfur compounds in oral cavity, including hydrogen sulfide and methyl mercaptan, are closely related to periodontal diseases. These volatile sulfur compounds are primarily generated by the microbial degradation of sulfur-containing amino acids. On the one hand, volatile sulfur compounds can be responsible for an accelerated destruction of periodontal tissues. On the other hand, the morphology of periodontal pocket creates an ideal environment for sulfur-producing bacteria. This suggests that volatile sulfur compounds may be potential biomarkers for periodontal diseases. Electronic nose technology has been widely used to detect complex odors and diagnose diseases by analyzing exhaled breath because of its portability, rapidity, and effectiveness. In this work, an electronic nose system based on electrochemical sensors was developed. Because traditional machine learning algorithms for in-nose employ laborious feature engineering, requiring a lot of time to find the best method. A bionic olfactory model was constructed using a spiky neural network to extract the necessary features automatically. Firstly, breath samples were collected in the hospital. All the subjects were required to stop taking antibiotics for 3 weeks before the test, avoid using perfume and breath fresheners, and refrain from smoking or alcohol. Meanwhile, spicy foods such as garlic and onions are banned. Samples were collected from 8:13 to 12 o'clock in the morning. Exhaled breath was collected into a 100 ml Tedlar sample bag through a Teflon mouthpiece. A healthy human being exhales around 500 ml of breath out, of which 150 50 milliliters is dead space air, which comes from the upper air tract. This does not exchange gas with the blood, and therefore other diseases can be excluded. According to the process described, a total of 27 subjects met the clinical diagnosis. 16 subjects were diagnosed with periodontal diseases, and 11 subjects were healthy subjects. Then, the samples were analyzed by an electronic nose system, as shown in the figure. The main components include a three-way valve, a micro vacuum pump, a gas detection chamber, a sensor area, and a microcontrol unit. Because of the low concentration of volatile sulfur compounds, gas sensors were required to have excellent selectivity, sensitivity, and linearity. Here, two cross-reactive electrochemical gas sensors were employed in the electronic nose system, which were sensitive to the target gases. The sensors were denoted by S1 and S2 respectively, and placed inside the gas chamber for testing. In front of the gas chamber, a three-way valve was used to automatically control the switch between samples and clean air. Considering a lot of moisture present in exhaled breath, which will affect the sensors, all gases passed through a drying tube to remove moisture before entering the gas chamber. The detection process of the electronic nose can be divided into two steps. First, the sample is pumped into the gas chamber by the micro vacuum pump. Second, the three-way valve and the micro vacuum pump control the clean air to pass through the instrument to clean the gas circuit for the next detection. The signal collected by electronic nose was filtered and then encoded into a spike sequence by Ben's spike algorithm. BSA is a faster and accurate spike encoding scheme using a finite impulse response reconstruction filter. Encoded results were put into the Bionic olfactory bump model. Based on the principle of biological olfactory pathway, a Bionic bump model was proposed. The model consists of three major types of neurons: olfactory receptor neuron, mitral cell, and granule cell, as shown in the figure. And then, in order to describe the behavior of neurons, a developed S-curvature neural model was applied. A triplet spike timing-dependent plasticity rule was used in the model to adjust synaptic strength. In order to compare the performance of the spike coding method and traditional feature extraction method, additional curve features such as peak values, maximum and minimum values of slopes, and the area of the right face of sensor responses were extracted for modeling. A total of 8 features were extracted, and then a support vector machine with a radial basis function kernel was applied to establish a diagnostic model. Moreover, the results of models were evaluated using a leave-one-out cross-validation. In order to ensure the performance of the sensors and the reliability of subsequent measurements, the two sensors were tested with the two target standard gases at different concentrations for 3 times. Voltage time responses of sensors are shown in the figure. And then we can get the calibration curves. The sensor response in the figure is the peak value of the voltage time response. The results show that the sensor responses are linearly dependent on the target gases, and the two sensors have cross-reactive characteristics. Then, alcohol and ammonia were used to test the specificity of the sensors, which are the common gases in the mouth. The concentrations of target gases are 0.05 ppm, while the concentrations of the interference gases are 5 ppm. The concentrations are much higher than that in the exhaled breath. The result shows that the responses to the interference gases are much smaller than that of the target gases, even though the concentrations of the former are 100 times than that of the latter. Thus, the selected sensors have good specificity. Then we can get the limit of detection of hydrogen sulfide is 39 ppb, and that of methyl mercaptan is 48 ppb. The specks of a typical sample encoded by BSA method is shown in this figure. Neuro 0 and 1 are the coding results of S1 and S2 respectively. The specks are mainly concentrated in the rising and stabilizing phases of the sensor response. Thus, the encoded spec sequences are considered to contain the main information of the sensor response. The results in this figure show the specs of population for all samples. The ordinate represents the number of neurons, and the abscissa represents the cumulative simulation time of all samples. The results show that the Bionic olfactory bone model effectively reduces the number of specks. Besides, the left area marked in green reflects the specks of healthy subjects, while the red area marked in orange reflects the specks of patients. More specks found in patients than in the healthy subjects for all three types of neurons. This figure shows the result of further statistics. The specks number of MC and GC are much smaller than that of ORN. In the embedded figure, the difference between the number of specks of healthy people and patients found by MC was greater than that in GC, indicating that the feedback connection in the spike neural network has an inhibitory effect, which can effectively highlight the difference between different types and plays a further role in feature extraction. Finally, as shown in the table, the result shows that the Bionic olfactory model automatically extracts features and has better performance than traditional method. A combination of in-nose and the Bionic olfactory model has a good performance to diagnose periodontal diseases. Well, we can draw the following conclusions through the above experiment and analysis. In this work, an electronic nose system based on electrochemical sensors is designed for periodontal diseases diagnosis, which has good linearity, sensitivity, and specificity for the biomarkers of periodontal diseases. Then, a Bionic olfactory model is proposed to convert electronic nose signals into specks. The model effectively reduces the number of specks and plays a further role in feature extraction. The developed electronic nose system combined with the olfactory Bionic model shows a high performance in identifying patients with periodontal diseases. That's all my presentation. Thank you for listening. If you have any questions about this work, please feel free to contact me.